When I think of Isabella, I think of her strength. When we first met, her baby was only 8 months old. He struggled to eat. He wasn't meeting developmental milestones. He seemed to always be sick. And Isabella carried every worry alone. She was a newly single mother in a city far from the life she once knew and hundreds of miles from familiar faces, routines, and the comfort of her home. But what stood out the most about Isabella was not her fear, it was her fire. She had already done something incredible brave. She walked away from abuse to protect her child and give him a chance at a better life. She left behind her career, her stability, and everything familiar because she believed her son deserved safety, hope, and love. She showed up to every appointment. She asked questions. She learned. She advocated. She held her baby close through every setback and determined that this story would not be defined by hardship. Where many would have understandably broken beneath the weight of it all, Isabella kept climbing. It is amazing to stand beside her and watch a mother becoming a hero in real time, building a new life from the ground up with nothing but courage, determination, and fierce love for her child. And it's surreal to think that we met almost by accident. I'm a parent educator with MHP Salud. Isabella came to us simply because someone told her about us. They weren't sure how we could help, but they knew we could.
The same fire that burns in Isabella burns in us. At one point, MHP Salud focused primarily on connecting families to healthcare coverage and care. It's still a big part of what we do. But when you're dedicated to meeting unmet needs in your community, you grow, you evolve, you take risks because the community needs you. For decades, MHP Salud was known for helping individuals in rural, underserved communities access health coverage and care. It was and still is important work, but we couldn't shake the belief that we could do more. We could do something different and make a bigger impact. So a few years ago, we took a significant risk. We changed our mission and we shifted course from a single touchpoint service helping people navigate healthcare access to a comprehensive model, bringing critical health, parenting, and education services right to families in their greatest times of need. For most families we serve, this is the first time they've ever even thought that it was truly possible to create a better life for their children, and we experience these successes every single day. While this has made a dramatic impact in our communities, we know further evolution is necessary, and we're already working towards it. There are so many unmet needs in rural and border communities, and true change, true impact can only occur when we embrace the comprehensive approach to service. All of our community work has led to what I believe is our organization's pivotal change and the driver of our greatest impact, the multiplier effect.
We see the impact of this model and we see the growing need across the country for this approach. So we made a stark pivot just about a year and a half ago to pursue a complete service line dedicated to workforce development. Our goal is to share our secrets to success, to help public health, hospital, education, and nonprofit professionals learn how to implement this approach into their own organizations. Our workforce development initiative has already trained hundreds of professionals, and the collective impact we're experiencing as a result is simply breathtaking.
But our impact won't stop there. We're advocating at state and national levels for greater funding and support for this work because it works. And when we succeed, it doesn't just benefit us. It doesn't just benefit the community health field. It benefits every single community. And at MHP Salud, that's the legacy we're pursuing. A legacy that empowers every community, every individual to believe in their strengths, to believe in their potential, and to believe in their future. Because at MHP Salud, we believe in our communities.